Hi, my name is Aaron Ruiz, and today I'll be explaining medical care in the Civil War. So just think of this as one of those ASAP science videos on YouTube, but instead of talking about science, we talk about history. As I said, we will be discussing the medical care in the Civil War. And just to be clear, this isn't the Civil War where superheroes are fighting each other over revealing identities or having to work under the government. But that does share some similar themes with the Civil War that I'm going to talk about. Now, just to fill you in on what the Civil War actually is, it was a war fought in the United States between the Union and the Confederates, which happened between 1861 and 1865. Basically, what happened was the Confederates wanted to establish itself as a separate state, resulting in disagreement and eventually leading to us fighting against ourselves. This had become one of the most important as well bloodiest battles in U.S. history, which meant lots of fatalities and lots of injuries, which brings up the question, what was the medical treatment like? Who provided it? What did they do? And how did they give the actual treatment to the soldiers? Well, to answer that question, we must understand what they were receiving treatment for. The list goes on, from dysentery, ague, smallpox, and many others. The list goes on. Now, many of the soldiers that had these diseases got immediate treatment, at least for the ones that came first or just got lucky enough to be taken in for treatment. Many soldiers actually died from not receiving treatment quick enough due to the lack of surgeons and doctors. The Union only had 98 registered doctors, while the Confederacy only had 24. So if they had a chance of bringing anyone in that considered themselves a doctor or a surgeon, they'd be hired. The problem with that was that new doctors that came in received military surgery manuals to educate themselves with what to do in the field, meaning some patients were potentially getting worked on by people that were performing surgery for the first time. Just imagine that. Now, with the topic of how the doctors and surgeons worked during the Civil War, let's discuss the topic of the actual treatment they gave to patients during the battle. So, you all know what pus is, right? It's that slimy stuff that recedes out of the infected wounds that you get when you cut yourself or fall off your bike. We all know of this, and it's indeed bad. But back then, the doctors and surgeons in the war thought this was actually a good thing. If someone had this pus in their wounds, it would be left alone, thinking that it was a positive thing, that they were getting better. But for the people who didn't have pus in their wounds, doctors would actually get the pus from other patients and spread them on the wounds of those who didn't have them, meaning infection had become a giant issue, and no one knew immediately why it was becoming such a problem. Disgusting, isn't it? Now, as you can see, with the higher rate of infection, there probably was a higher rate of death. But besides the topic of pus and wounds, you have probably seen pictures and maybe even scenes in movies that show amputation during battles. Well, let's discuss that actually. How were the amputations done in that type of environment? Most of the wounds of soldiers were found usually on the arms and legs, either being small wounds or even gaping wounds. It had become the point where amputation had become the best chance of survival for injured soldiers rather than regular treatment like medicine. If an amputation were to be delayed for 48 hours, a lot of things would start happening to the patient, such as blood poisoning, bone infection, and gangrene. All of those would start setting in, rising up the death rate to double. Now, most amputations were done in 24 hours, and when amputating, they would use chloroform as a form of anesthesia for patients, so that they would not feel anything during the surgery. Now, of course, before they were brought for medical treatment, they would either have to be in the battlefield or maybe near one of the medical corps. So, what would happen if someone were wounded in the battlefield? Well, as I said, the medical corps would rush to the place where the wounded are and then bring them to an aid station as soon as possible so they can be treated. Now, as soon as they got to an aid station nearby, the patients would most likely receive painkillers and alcohol, helping them to recover mentally as well physically during the surgery. Now, they would also receive packs of lint and bandages to wrap around the wound so that it would stop the bleeding. After the treatment was finished, they would transport the soldiers by ambulance to a field hospital where they would rest and recover. But just because the soldiers were receiving medical attention by going to a hospital didn't mean they were fully recovered. The trip from the camp to the hospital could be very long, and also could be very cold or hot depending on the weather, which meant increasing the pain of the patient, and maybe even the person bringing the patient to the nearby hospital. Again, as I said, infection was a big factor of the death of soldiers in the battle, especially after surgery. This is why field hospitals were made. They were so nearby to the camp that they didn't have to waste time and go a long distance just to save someone. It was very convenient, very quick, and very simple. Now, as you can see from all the points I made about the medical treatment in the Civil War, it doesn't seem so great, but it was absolutely necessary to have them. Without them, soldiers would have just died in the war, and it would have been such a shorter fight. Well, that's the end of my presentation, and I hope you got to learn something today. Either you learned something new, or you received new knowledge about something you already knew. Either case, hope you enjoyed my presentation, and keep learning history.